increase your charges. Okay, I'm an affordable doctor who anybody can touch. And still, if somebody says I can't afford, I will not charge. I'm very clear about that.
I
Okay,
know
right now also, I'm very clear about it. I am very high on my principles because, and Deepak knows very well that,
That everybody knows about this
He'll
and-
call me and he'll tell me, in fact, he called me, why have you not come? You don't have a car. And that was absolutely true because I didn't have a car. Okay, I didn't have a car because my car had gone to pick up somebody else. So I had to wait for my driver. And I still drive a good Indian Maruti. I'm very happy with it.
But 1,000 companies can come to give you a car.
No, I don't want all that.
Okay,
I don't want any
All right,
support.
that
Yeah.
is actually your greatness that you have been doing for years. I will ask you a very basic question.
Tell me.
Brand India is winning. This is the title of the theme also. Do you believe that we have arrived in terms of Brand India when more than 70% of the Indian population who live in villages don't have access to basic health? Can we claim ourselves to be in the league of the super nations when more than half the populations do not have access to medicines?
So I'll answer your question. Okay. And I'll answer your question about basic demographics. Okay. We are living longer. What was the longevity and age of an Indian when I did my MBBS? It was only 51. What is the age of an Indian today before he dies? It is 68. So if you see simply age, we are living longer. Why are we living longer? Because we have better quality of life. Okay, we have less diseases. Even if you go to the most rural places, you will have dawai. It may be allopathic, it may be non-allopathic, but dawai is available. It may be in private, it may be in public. Even if you go to the poorest primary health center, there is active media. They will show that there is no medicine given there, but medicine is there. I am saying something is better than nothing. I think 30 years back we had nothing. Today we have something. We need to reach there. I don't say that there is nothing available. In fact, the old government had Usha and Asha scheme. They wanted to have the National Rural Health Mission. But I think we have had victory over polio. We have definitely vaccinated our children. We probably never got vaccines. We have definitely advanced on communicable diseases to a great extent.
I would like to
but
just-
I agree with you that we still need to advance into many more accessible healthcare. And I personally feel that everything is not up to the government. I think we have a tendency to blame the government for everything. Not because I go to a government hospital, but I think equal onus is on each one of us. Okay, we should do something back as a corporate social responsibility.
Someone who is considered to be the healthcare leader of the country like you,
Who?
someone like you, whether you accept it or not, what do you have to say when Prime Minister Modi announced national draft for healthcare policy when he came to power on that basis? It's not there at all now. What is?
So I don't want to comment on that. I've sent my comments actually on paper to Mr. Nadda, who's the current health minister. And they are looking at it. They will take time. I think we are being very, very impatient with the current government. They want to do things. At least they want to have clean India. If you have clean India, you will at least 50% of disease will go. People are only looking at a 0.5% service tax on the Swachh Bharat, which is coming on them. But I think they want to do at least a cleaner India. Cleaner India means healthier India. So at least some things you should look at the positives. I don't look at the empty glass. I look at whatever little water is there in the glass. I don't drink alcohol, you know that. Okay. And I live on water. So I think I look at the little fill. I think he wants to drop a few positive drops. Look at the positive drops, forget about the negative drops, and look at his marketing. If he uses the same marketing of his into healthcare for health education, people will not have diseases. If we walk more, okay, if we are physically more active, don't eat fried food, fast food, eat on time, sleep on time, we'll have a healthier India. What we have done is we have conquered non-communicable diseases and we have grown non-communicable diseases. We have grown heart disease. Okay, so we have grown another industry altogether. And if cosmetic industry is surviving, because I see you are full with panel of all cosmetology, if cosmetology industry is surviving in India, which means brand India is already successful. Because people go to a dentist and cosmetologist only when they can afford. And poorest of people go. Okay, it is not the most affording people. Poorest of people also want to look good.
Let
If
me
they
share
want
you.
to look good,
Let me share you one conversation which has a direct link to what you have spoken actually.
Huh.
India's top 5 cardiac thoracic surgeon, Dr. Kaushal Pandey, who is well known actually. He's
He's a very
international.
silent man. He is
Very
not-
silent man. Very
he
silent.
is a silent worker. We know him because our patients
Yes.
give him blessings.
He doesn't
See,
go to
he's
any
a silent
conference.
worker. I don't interact with him ever. He does his own round, I do my own round. But patients bless him. A lot of my patients go to him, they bless him because he is not a cutthroat guy.
Yes, he's
the
an
way
unsung
people
hero.
cut people.
He's an unsung hero.
Yeah.
When I asked him to give a talk on your breakthrough innovation in cardiac surgery, he told Satya, I don't want to speak on that subject. This is direct link to brand India, what you've spoken. He is telling, I want to speak about that we have world-class professionals, we have world-class individuals, but are very mediocre institutions. Today he's talking about that. And he's also talking to me that shortages of doctors in India and how the doctors are not, there are not enough doctors in India. That is what the cheap medical education in the country is creating a problem. Am I right or wrong?
There is acute shortage of doctors all over the world. And India is one of the
So
largest exporters.
why you wanted to speak on the subject?
So I think there is a clear shortage of doctors. Across the world, India is also there, and India is the largest exporter. You know, right now, the person who dropped me is actually one of my students who wants to go to America because he written 3 research papers and I'm writing his recommendation letter to a Ivy League university. I don't even know, he was educating me from there to here that Ivy League university is actually a football university, football league. I didn't even know it's a football league, you know. I don't even see football. Okay, and then I was talking to Sumita Jagyasi, I don't know where she is.
Must be there, yes. He's there in the
My
panel.
batchmate. Okay, so her son is gone to UC Berkeley. Okay, so now these people we are only exporting. We are an export house. Best nurses in India are where? In Middle East, UK and USA and New Zealand and Australia. Best doctors of India are where? They are again there. Best of India is outside. But mind you, there is also a reverse migration which has started because people find it attractive enough to come here. Whether you like it or not, okay, I think India is still, I am a first citizen of India. I think we are in a first class country. People may think we are third class. We are a first class citizen in a first class country.
Fantastic. On that positive
Okay, I
note,
don't
I'd
think
like-
we are second class or third class. We have arrived. I am very proud. See, we may not be having all those aristocratic big cars. Okay, but we are simple people. Okay, our ancestors were simple people. Okay, even to go to loo, they used to carry a lota and go. Okay, what is wrong? And I am very proud that our ancestors did that. They had no diabetes. America already has started getting diabetes and obesity. They were doing smoking drugs. Now we have imported all those things from them. What is killing us today? What is killing our youngsters? Television, because physical activity is smartphones and gadgets. Trust me, I was in Vancouver presenting. We have now got a new guideline that you should have every day 2 hours device free time. You should switch off all devices. You know, half of you will go in withdrawal syndrome because you are addicted to your phones. No, I'm telling you. Otherwise, you are going to develop a new addiction. That is number one. Number two, we are addicted to fast foods. Okay, pizza is like an Indian national dish. Not because indirectly Italy was ruling us.
So
Okay.
should we ban
But
Should we
trust
ban
me,
this?
But these are all fast foods, no? What are fast foods? Fast foods are killer foods. They are trans fats. Okay, they are growing everybody's business, but we are not happy with that business.
One of
Even
the Nestle executive is here, so Maggie might take it in the wrong sense, yeah.
No, but I think what I personally feel that we definitely need
arrived.
to be proactive and we need to be proud. I think we are very sheepish. Okay, as Indians we are very sheepish. We actually deliver the best care. I think if somebody was doing hair transplant, I think that person can do a better job than somebody who's doing in America. Not because just because they have a white skin they do a better job. Not necessarily. They are more systematic than us. They publish systematically. They do less work. They are less crowded, and that is why their efficiency and output is better. We
Okay.
are overcrowded. We are overcrowded. We are over. So I think I agree with Kaushal completely that we are overcrowded. Despite of overcrowded, we still deliver quality care. And that
Okay,
is something, and our outcomes, if you study our outcomes, they are the best. Look at his outcomes and compare it with any cardiac surgeon. He's like a one-man institution. You see the outcomes, no? Ultimately, you see the outcomes.
Yes, very true, very
So
true.
our outcomes are comparable at an affordable cost. So we should be proud of it. Only problem is we don't have the time to publish it in evidence-based way, and that time will come.
Okay, on that very positive note, I would like to invite Mr. Krishna Kumar to summarize very briefly of Dr. Shashank Joshi presentation. I'm very happy that Brand India is winning. It is all our wish that Brand India should win. We are in a country of great nations. Please be here for some time.
Thank you, Dr. Joshi. And yes, thank you so much for saying that as Indians, we need to be proud. As Indians, we need to be confident. We are not just equal to, but I just reckon we are better than the best in the world. And we've proved it in several spheres of activity. And, Brahma earlier on in the morning said that I've been traveling around the world, and I've been traveling for close to about 2 decades now. And compared to what it was maybe in the early 90s or so, or probably mid-90s, today, we Indians really, really command tremendous regard, respect all across the world. And that's why I entirely agree with you when you say brand India has arrived, and also that India has really arrived on the global scene. So thank you very much for that.
I'll tell
In addition to that dialogue which you had, Brahma and you, you also mentioned that, well, as brand India has arrived, a lot of positives there. You mentioned we are number 2 in diabetes, number 1 in hypertension, right? Yes, as a country of 1.25, 1.3 billion people, for the sheer numbers, maybe total number of people with diabetes and hypertension may be more. But my only thought process and query to you is it only because of the numbers, or is it something to do with lifestyle? You said about fast food, you said about the Italian legacy and stuff like that in a humorous manner. But that apart, is there something more to do with it, why these two figures are staggeringly high for Indians?
I think the answer is very simple. We are thin fat Indians. So
Sorry?
we are thin fat Indians.
Okay.
We eat too much of carbs, too much of fat, too little proteins. And we definitely have become more and more sedentary. So there are 2 key words why you are getting non-communicable diseases in India. One is sedentarism. We have become more and more sedentary compared to our ancestors.
Couldn't agree with you
And
more.
second is we have become affluent. So I call it affluenza. Both of the words are published by me. And because we have become affluent, we have changed our socio-economic grade very fast. The social gradient has changed very fast. Even rural India will outwit urban India now in hypertension and diabetes. And that's the area which I study. We did a twin epidemic study a couple of years back. And therefore, it's clearly there. It is not genes. Everybody blames us on genes. You know, my father, my mother, it's nothing to do with genes. It's all got to do with the lifestyle. There is a genetic trait. But we clearly it's acquired. Because traditionally we had famines. And therefore, we had a fuel storage gene in our abdomen. And then what happened? We used to burn it because we are physically active. Now what has happened? We are sitting on chairs. You should be standing. Okay, chairs are only 200 years old. Otherwise, they were only thrones. And people used to sit down and squat. Okay, or they used to stand. So because of basically sedentary habit and affluenza, which has crept in, that is the primary reason we are heading those numbers. But I am not pessimistic because we want to be the care capital of the world. And I think we should prevent. We need strong messages. I think another 15, 20 years down the line, I am reasonably positive that things will be better. Like, for example, smoking, it's coming down. Thanks to our two, three, ministries back, we had a very strong health minister who was anti-smoking. And you see smoking coming down. Only women are smoking a little more. But if you see the smoking status, it's gone down in India, which we should be very proud of. We don't talk of the positives in India at all. We only look at the negatives. Smoking actually has gone down in India. Okay? So I think we should be positive. Now we are banning trans fats. All these fast foods are all killer foods. Okay? Potato chips means they are frying the endothelium so that one can go for an angioplasty or a bypass. Okay? So I think we definitely need to change our lifestyle. Period.
All right. from that
Absolutely.
good
I
notes-
think just one last point, Brahma. I mean, yes, you made a very fair point there. I mean, the first thing is we all need to be positive, and we agree with you. And that's what I said. But talking of sedentary habits, yes, I think you also mentioned all of us need to contribute towards changing that lifestyle. And yes, affluenza is probably a good thing to have, but the sedentary part of it is probably not good. And that's why, all of us in society can contribute towards that. Like, I know groups of people in different major cities who form small groups and who are actually addressing school principals, because they found that modern children in schools today, when they come back home, as opposed to most of us, we used to want to rush to the playground and play. They're more happy sitting with that Android and playing some games and stuff like that. And that is where the sedentariness starts, I believe. And they've formed groups of people that go and address principals and tell, please talk to your parents and say, when the children come back home, send them to the playground. Don't make them sit at home. So I think these kind of initiatives help a lot. So thank you very much, Dr. Joshi.
That was a fantastic presentation. I wanted to share you one thing over here. Brand India is definitely winning. At least pharma leaders believe that Brand India is winning. Today, it must be the proud moment of Dr. Shashank, who is a very good friend of mine, that his father is getting the Lifetime Achievement Award. Professor R.D. Joshi, someone who has done so much for the pharma industry, working with OPPI for such a long time. Pharma leader has spotted that one and will be felicitating today You'll be arriving after sometimes during the award presentation ceremony. Brand India is winning because these are the people who are getting importance. We believe in empowering people. Pharma leaders is all about empowerment. It is all about innovations. Thank you for a wonderful presentation.